Hi everyone, I'm Carrie Chevarelli. I'm an Austin-based physical therapist and the owner of Healing Foundations Physical Therapy. I'm also a breast cancer survivor, having gone through treatment with chemoradiation and deep flap reconstruction. Happy to be providing some video footage to hopefully help you in your journey of recovery following surgery. I will say, please consult with your physician prior to doing anything that you see in these videos to make sure that it's safe for you and that you've been cleared medically before performing any stretching or modalities of choice. Thank you. One of the easiest and first stretches you can do to stretch the pectoral muscle is using the Doorframe. This is most ideal for patients who are not allowed to bring their arms above shoulder level. So Tasha's going to bring her left arm and rest it on the inside of the Doorframe. She's going to slowly take her body stepping through the Doorframe just until she feels a stretch coming across in front of the left shoulder, across the top of the left chest. She's going to take some deep breaths. Spend 20 or 30 seconds in this position and then slowly move herself back to neutral. This can be repeated several times. Make sure that your position of your arm is comfortable and that you're not raising the shoulder excessively as you do this stretch. One of the best and easiest first stretches to do post-op is with the doorway, with the arm simply extended. So Tasha's going to bring her left arm and hold on to the edge of the Doorframe, and then all she's going to do is keep her shoulder down and simply turn her hips the opposite direction. This brings a stretch across the top of the chest and down through the nerves in the arm. Breathing while she's doing this, keeping herself relaxed. This, of course, can be modified by stepping closer to the arm or further in front of the arm for less or more stretch. So one of the major muscle groups that's often affected in a breast surgery is the pectoralis muscles, which are above the breast at the top of the chest, between the shoulder and the breast. They sometimes are cut, they are sometimes repositioned during the surgery. So we're going to discuss how you can do a self-massage technique to alleviate some of the tightness or pain in that muscle group. So you'll notice that the patient has her arm elevated on a small pillow. This puts the pectoralis muscle on a slack position, which is where you'd want to be ideally if you're going to do a massage. The pectoralis muscle starts at the top of the breast and goes at an angle towards the shoulder. So the patient would bring her hand over like so and feel along the muscle for any areas that are sore or she feels tightness. She's going to make small circles like so until she feels that tightness or that restriction relax, moving at an angle up towards the shoulder. And she can also bring her hand along the side of the muscle, relax your hand, and kind of grip the muscle and massage like so. Oftentimes there's accumulation of fluid in the area, and that will also help activate the lymphatic vessels to help move that fluid out. If there has been a tissue expander placed, the pectoralis muscle might be slightly higher than it would be normally, but you should be able to feel the difference between your rib cage and where the muscle lies. You want to make sure you avoid, if you do have a tissue expander, the lateral wall of the chest and the sternal area if it's especially tender. Just like so. One thing to be aware of after breast surgery is the impact that it has upon the local lymphatic vessels. The local lymphatic vessels are located in the chest wall and up towards the armpit, across the top of the chest, and throughout the breast. So if you notice that you have an excessive amount of fluid in that area, please consult with your physician as to treating that as a lymphatic condition prior to doing any type of massage or soft tissue work. If you're a patient who has had a deep flap reconstruction, there are some additional massage techniques that you may find helpful following your surgery. The flap immediately post-op is often very hard and firm feeling, and when the doctor has released you to start self-massage techniques, it can feel very, very soothing and also help with fluid congestion in the area. Most of us will find when we palpate along the side of the breast that it feels like there's a shelf or a wall. That is the edge of the flap. So that's the area that you want to focus on. So you bring your hand over and feel where that wall or that shelf is, and just sort of rub across it and towards the armpit in easy, gentle strokes. Imagining that you're rolling out bread or you're rolling out pastry dough, trying to make it smoother and softer. I hope you found these stretches to be helpful for you as you recover from your surgery. Please remember to consult with your doctor and heed any post-op instructions that they may have given you prior to performing any of these techniques that we've shown you. Make sure that you keep yourself comfortable and safe. Make sure that you heed any sort of warnings or safety measures that you need to. Thank you for watching this, and I wish you the best of health.